I'm Jennifer Shull. I'm a nurse practitioner here in the wound clinic.
And I'm Dr. Timothy O'Brien. I'm a general surgeon here. I also work in the wound clinic.
So anytime a wound does not progress through the normal healing, it becomes stalled out and becomes a chronic wound. And those are the wounds that we treat mostly here. We do several different types of wounds, but that's one of our most common types. So wounds that have stalled out and just don't seem to be getting any better. And they can be from several different causes. We could have wounds from poor arterial flow, poor venous flow, from pressure injuries. So there's multiple different causes, so it's easier if you come in here, we can look at the wound, examine it, figure out what's going on, and find out the best treatment for it.
And certainly one of the most common reasons why wounds won't heal is because, particularly with legs, the leg tends to be swollen. A lot of people have problems with what we call chronic edema of the lower extremity. Sometimes it's due to the valves in their veins not working very well. Sometimes it's just due to them retaining fluid. But one of the most common reasons why wounds won't heal as quickly as we'd like is because of swelling in the legs. The easiest way to prevent swelling in your legs is to be active and walk. And if you do tend to retain fluid, to keep your feet elevated when you're not on your feet. Certainly sitting with your feet in a dependent position will worsen swelling. And if people do have issues with the valves in their legs, particularly if they've at some point in the past had a blood clot in their leg, then oftentimes wearing compression type stockings to help keep the fluid flowing back out of the legs back up toward the heart will help considerably. If you come to us with a chronic wound that hasn't been healing on its own, one of the things we'll look at, like we say, is the swelling. We'll get the swelling down in the leg. And in addition to the swelling in the leg, there has to be enough blood flow getting to the leg, what we call inflow. And if there's any possibility that the foot or the leg doesn't appear to be getting enough blood, we can do some simple blood pressure tests just to make sure that the blood flow to your leg is adequate. And if that is the case, then usually we'll start by cleaning up the wound. A lot of times having not very healthy tissue in the wound will slow the healing down, and we frequently will use what we call a curette to debride the wound and get some of that non-healthy tissue out of there, which usually will help to speed up the healing process.
So if you do find that you need wound care services, hopefully you don't, but if you do, there's a couple ways to get a hold of us. You can either get a hold of us through your primary care. They can refer you to us and they'll set up an appointment for you. Or you can call us directly at 740-380-8171.